In today's Your Health segment, most women know as they age, their fertility declines. But to what extent? And what can women do to be proactive about their fertility? Fertility specialist Dr. Ryan Riggs from HCA Midwest Health is here to answer these questions. Good afternoon, Dr. Riggs.
Good afternoon, Kelly. Thanks for having me.
Yeah, no problem. Now, according to the CDC, 10 to 15% of couples are infertile. How do women know if they have fertility issues?
Well, I think that's part of the challenge with fertility and infertility. There aren't always signs. I mean, there's the obvious sign of inability to get pregnant, and we think of infertility as not being able to conceive after a year of trying if you're under 35. And if you're over 35, we take a little less time because of the impact of age on reproduction is, say, 6 months.
Now, what can couples having trouble getting pregnant do? Are there any new fertility treatment options?
We certainly have our old mainstays, diet and lifestyle modification. You want to do what I call the low-hanging fruit things, exercise, don't smoke. Additionally, we have oral medications and inseminations. And then for some of the maybe more challenging cases, we have in vitro fertilization, and newer things in the past few years are genetic testing of embryos, egg freezing, which is, I think, a remarkable opportunity for women who want to delay childbearing. And probably the newest thing is molecular uterine testing that looks at receptivity in the uterus.
And I wanted to ask you about freezing your eggs because it's popular these days. We hear lots of people talking about that. What can you tell us about the so-called egg banking fertility service that's booming right now?
Well, I think it's just an amazing opportunity because it's one of those things that seems too good to be true, but it really isn't. So the biggest challenge we have in fertility is the impact of aging on the egg, really. Sperm doesn't really age to the extent that the egg does. So when we freeze the eggs, we essentially put them in suspended animation, kind of like a time capsule. So we want to freeze eggs as young as we can, and the younger the better. The average age patient that we're freezing eggs now is probably 35 to 37, and we really would like to catch those ladies when they're a little bit younger because they have a much higher pregnancy rate with dramatically fewer eggs.
What is that process like?
Well, it's actually easier than you would think. It takes about a month and a half total, and that includes all of the work up to freezing the eggs. The actual process of getting the eggs takes about a week and a half, where we stimulate the ovaries with eggs and then do a procedure where we retrieve those eggs, and then we're all done. And those eggs can be frozen for probably hundreds and hundreds of years, longer than any of us would need them.
Well, thank you so much, Dr. Riggs, for joining us this afternoon. And for more segments like this, go to kctv5.com/HCA Midwest.